Hello Katie, this is Damon. I'm going to record for you how to burn a CD on the CT scanner. First of all, I'm at the panel machine. Some computers will burn CDs, others have not been configured yet to do so. The one at the panel does, the one in the conference room does, the one inside console right now does not. So I have a disc that I took from the back. I put the patient's name on it, what I want done, the date, and which office it came from. The label is on the outside. Pretend the computer is laying flat on the table. I can't. There we go. So the writing is up. There. It goes in. You got to get the disc the right way in the computer. Click on the patient. Okay, the window popped up. You want to do it like a CD DVD player, not a flash drive. Next. You get this window. I don't do anything with it, I just minimize it. Go to the patient you want to open. Oh, sometimes those will pop up. Erase those. Just click on the screen, that thing will go away. Alright, go into the image. Okay, so we're going to select on this, bring it up just like a normal, you're reviewing a CT. Now, there's 3 dots at the top of the screen. There, as soon as you touch those dots, this menu pops down, in which the only thing you'll ever use up here, I think, is called export volume. Okay, go to export volume. Now this window is important. You want to say single frame. Click on the single frame. Leave the rest of that alone. Well, now whether or not you want to leave, see the implant? You have to decide whether or not you want to leave the implant in there or not. Which means include nerves and implants. Okay, if it's going to Dr. Denny, probably not, because he's going to make up his own mind what kind of implant he wants to do. So I would not include the nerves and implants. But if it's going to the lab, they do want to see that because they want to know what you decide so they can make a surgical guide. But in this case, we will include. We'll pretend this is going to the lab. Okay, then go to export. Folder means you're going to save it to your desktop, but we're not doing that. We're saving it to a DVD that's already in the player. This is important. Include the viewer, because whoever you're sending this to probably does not have a Planmeca ProMax CT scanner, so they're going to need the viewer that helps them read the CD. Okay? And then type in a name. This patient's name is Darlene. I'm not going to type the whole thing. So when it comes up, they'll know what file to look for. Hit OK. Some things will happen. Prepare for export. Once it says it's burning the CD, you're good to go. It'll take about 5 minutes, and then the computer will pop it out when it's done. But don't walk away from the computer until you're sure it's burning, because it might get an error or something and you might have to start over. Anyway, I'll stop here. These words will change and just saying the CD is now burning, and then you know you're good to go. Okay? Then you just label it and put it in the mail.